Well, thank you for that. May is Mental Health Awareness Month, and according to the CDC, nearly 3 in 5 teenage girls feel persistently sad or hopeless. That is the highest level in the last decade. Dr. Laura Erickson-Schroth, Chief Medical Officer from the Jed Foundation, is joining us live with more on the challenges young people face every single day. First of all, thank you so much for being with us. We talk all the time, especially on this show, about the contributing factors to the growing mental health challenges for teens and young adults. You see things like social media, a lot of comparison that ends up happening. You know, people being able, these teens able to take their phones now into their bedroom. The bullying doesn't just happen at school, it happens right in their own homes. What can be done?
Yeah, I think you're pointing out some really important things. One is that we are seeing real trends in mental health for young people right now. So if you look at the CDC data, you know, the percentage of teenagers who are reporting feeling persistently sad or hopeless has increased about 14 percentage points in the last decade, from about 28 to 42%. And suicide is actually the second leading cause of death for young people ages 10 to 34. So we're seeing these numbers play out. And I think you're right, there's a lot going on. Young people are living their lives online in the way that you're talking about. And I think that that's having positive and negative effects both, right? So young people are able to seek out community in ways that they weren't in the past, especially, for example, for LGBTQ young people, for youth of color who are really looking for places that they might not be able to find in real life in their communities. Young people are also dealing with information overload, just, you know, their news feeds showing them on a daily basis just stressful things in the world, like school shootings, the climate crisis, racial violence around our country, wars around the world, and they're dealing with a lot. I think that the core issue that's going on right now has to do with social connection and community.
Yeah.
So the Surgeon General, have you seen the Surgeon General's report?
Yes, and the fact that loneliness, you know, we talked about it on the show. There's simple things like we moved the front porch to the backyard, and we've really closed one another off. Then you had the pandemic happen where you have such loneliness. I do wonder, though, you know, I have so many friends with teenage girls I talk to that say, you know, they seem very happy at home, and then I hear from their teacher that they're really struggling. I didn't know that, or a coach comes forward. How can people recognize, and parents specifically, recognize those warning signs that a young person is struggling? Because I think teens are really resilient in that they hide things pretty well.
Yeah, I think you're pointing out something that we work on a lot at the Jed Foundation, which is helping young people and adults in their lives to recognize signs of distress, to support them, to connect them to resources, because actually the people closest to you in your life are the people, it's not going to be necessarily therapists or psychiatrists that are needed to recognize, you know, what's going on with someone. It's going to be people in your life who know you and can recognize changes in your mood or your behavior. So some of the things to look for include social isolation, so less sort of connection with friends and family, spending more time alone, lack of interest in the kind of things that you used to be really interested in and spend your time doing. Big changes in your eating or sleeping patterns, in your hygiene, for young people, academic changes, or increased use of drugs or alcohol. And any of those kind of things, if you're worried, that's the time to reach out to that young person and talk with them and have a conversation.
Yeah, I know sometimes just talking and being able to be a safe place where kids can reveal their feelings is so important. So thank you so much for joining us. We really appreciate your time and all the work that you're doing at the Jed Foundation. Thank you.
Absolutely. Thank you.